So, Grandmaster class, 7 Sentinels. This is Peter Simon with you. And today we are going to do one writing task. Writing task. Practice with Peter. Hello? Yes. Yeah, I'm explaining. If you are interested, you can attend. I'm explaining a writing task. Gerald Baker. The YouTube you can see. Yeah, in the YouTube. Live. Okay, live. You want to come? Okay, I'll give you the link for this one in Zoom. You have Zoom. Yeah. I'm fine. Okay. So here, writing task. So we are going to study writing task. So these are the students who registered the names. And so you are with me now. And today we are going to see Gerald Baker. Practice with Peter, lecture number 1. Practice with Peter. Gerald Baker. Left total hip replacement. Yes. Yes, here you are. This is the writing task. I'm going to explain. Okay. So this is how you are going to have. Okay. So now let us see here. I'm going to show you some things which are very, very important. So first thing is, okay, The patient's name is Gerald Baker. Mr. Gerald Baker. This is the patient's name. Yeah. Mr. Gerald Baker is the name of the patient. Okay. So, and his age is 79. His age is 79. So 79 years old. Remember that. And today's date is 7th September 2008. So this is the date you are going to write in your letter. So these are the important things you have to notice. These are the important things you have to notice. So just go through with the important points. Right. Next one is, so today's date is 7 September 2018. And 17 on the ward of a hospital in which you are charge nurse. So you are charge nurse. You are a charge nurse. So you are sincerely charge nurse. And the ward of a hospital. So hospital, city hospital. This is the hospital. You should know from where you are getting the information. So it is a city hospital. City hospital. Yes, that is the city hospital. Yeah. So charge nurse, city hospital. Admission date is 3rd September 2018. 3rd September 2018, she was admitted to the city hospital and discharged on 7th September, same date. So this is the discharge date. This is the discharge date. Okay. So fine. Right. This is the discharge date. Okay. So many students, I'm not giving permission. Only those students who are serious I'm giving. I don't want to take more number of students. So I'm taking only those students who have registered with me and those who are available to register through Zoom. Okay. So I'm not giving open sessions anymore. So it's better you have to get a thoroughfare, and you can see from what number of students. Zoom session. Right. So ward of a hospital, the ward. Okay, the ward. So it's a ward. Okay. So the inpatient ward. Inpatient ward. So patient is there with admitted after admission. So inpatient ward. Outpatient ward, no, inpatient ward. So hospital's name is City Hospital. You'll get these three things here. Charge nurse, inpatient ward, City Hospital. So these are the three things you can take here. It is your address. It is your address here. So charge nurse. It is charge nurse. Enter inpatient ward. Inpatient ward, City Hospital. So we got the address here. That's very clear now. So this is the style how you will go. So this is 6.1. 6.1. And this is 6.2. Many people don't know from where you will get the information. They just write, okay, charge nurse and leave it. They don't know from where this information they will get. So you have to write these three things: 6.1, 6.2, 6.3. So the first one is charge nurse. So the first one is charge nurse. City Hospital. Inpatient ward. And charge nurse. These are the three things: charge nurse, inpatient ward, City Hospital. This is how you have to write. It's very important that you have to write these three things. Okay. So now let us see here. Okay. So to avoid some confusion, I'll remove this, because again they will not, and some people may not understand. Yeah. So charge nurse, inpatient ward, City Hospital. These are the things you have to write. This is not 6.1 actually, this is 7.1. This is the address, sender's address. Okay, sender's address. So this is the sender's particulars. The sender's particulars. The sender's particulars. So here it is. This is 7. Point number 7. Component 7, number 7. So, right. So that is how it is. The sender's particulars. Okay. So these are the three things you are going to write there. Now here, this is 7.1. Okay. Then this is 7.2. And this is 7.3. Okay. So these are the, okay, fine. 7.1, 7.2, 7.3. You have to write these three things. Fine. Next, before this one, you have to write 6.0. That is, okay, you are writing to whom? Now, what are the other important points? So, reason for admission. Reason means purpose. Reason means purpose. You have to know. Purpose. Reason for admission. That is the purpose. Who is this Chinnappa Raju? Okay. So fine. We have the purpose here. It's very important. Okay. So what is the purpose of the letter? Why is he admitted? Why is he admitted? That is important here. Yeah. Fine. So, reason for admission. He was admitted on the 3rd and on the 4th September 2018. Okay, 4th September 2018. Yes, this has, he underwent a left total hip replacement. This is the purpose of the letter. So he underwent a left total hip replacement. Okay, right. And this is elective surgery. This is elective surgery. So this is very special letter, very special explanation. That is why I will not invite every student here, because I don't want, many students here just to disturb. Okay, because earlier when I was teaching, I heard somebody say, so that's it. When we involve in the lecture, I want to focus. There will be people coming simply and commenting all nonsense things. I don't want such a, half-hearted people. Okay, those who are really serious, only they can come. Otherwise, let them not come. So who is this? Okay. Right. Okay, let me admit and see. Who is this Raju? Hello, Mr. Chinnappa Raju. Who is this? Unmute, please. Can I know your name?
Hello, sir.
Yes.
My name is Teresa, sir.
Can you type your name in here? Because I don't recognize any Chinnappa Raju. So I want your name to be typed here.
Okay, sir.
Okay, you can just type your name there. So I told you name, please. Because all the students will be with the names only. Okay. Please type your name. Yeah. Fine. So, yeah, am I audible to you, Chinnappa Raju? Name, please. Yeah, Teresa. Oh, okay. Right, next time when you come, you register your name with the name like this.
Okay,
Rename. Teresa. Because that is the reason why you are waiting. Because only for the regular students, invitation will be there. Not for everyone. So always you have to come with the two names. First name and the second name. Yeah. Bandanadam Raju. Okay. Bandanadamraju. Yeah, this is how your name should be there. Next time onwards. So that is why you are waiting there. Yeah. Okay, fine. So, right. You can mute back. Mute. Yes. Fine. Yeah. Okay. So here, this is an elective surgery. Okay. Right. Fine. And the second one is worsening osteoarthritis. So this is another complaint. Another complaint. And here, difficulty mobilizing. So problem, two problems. Difficulty mobilizing. Okay, this is one problem. And then the second problem is climbing stairs. Climbing up and climbing down the stairs. So up and down the stairs. So these are the two problems. Okay. Next. So he lives at Grey Walls Nursing Home. This is his place of residence. He doesn't live at his home. He lives in Grey Walls Nursing Home. So this is very important. That means he came from there and he will go there only. He came from there and he will go from there. Yes. Right. That's very, very essential. Okay. So, and he has been living there for 4 years. 4 years he has been living there. That means those people in the Greyval's nursing home, they know everything. That means he's a known patient for them. They know everything about him for the last 4 years. They know his problems. They know his treatment. They know his medications. So that means it is known patient, known case, known case. The other person, yeah. So Mr. Gerald Baker, they know him. Everyone knows him. Everyone at Greyval's nursing home know this person. So this is a known case, known patient, a known case. That's very clear here. So they know him for 4 years. They know everything about him. Okay. Right. Now see here. No children, employed as a radio engineer until retirement age 65. 65. And now, yeah, 79. Now he's 79. So 65. See this relation here. Retirement, he was retired at 65. And now he is an aged pensioner. Hobbies. Sister's name is Dawn Mason. Sister's name is Dawn Mason. Yes. Next. Hobbies. Okay. Visits regularly, supportive, plays chess, no signs of dementia. Then 2016, osteoarthritis. You see here. 2016, osteoarthritis. Requiring total hip replacement surgery. Okay. Now you can see here, this is 2018. Okay. Right. You can see there. In 2018, he got left total hip replacement. So this was required 2016. That means 2 years before. That means this problem they know. Because he is staying here for the last 4 years. For the last 4 years. So even before history, they know. They know about hypertension. 1989, they know about his hypertension and ongoing management. Now also the treatment is going on. 2016 osteoarthritis requiring total hip replacement surgery. Yeah, it required, but now only 2018 only replacement done. You can see that. So that time he required, but not done, not completed. Now it is hypertension going on from 1989 onwards. Ongoing management, hypertension. And this is ongoing. That means important. Means continued care. Ongoing management. Yes, now also it's going on. So it is important. You're supposed to write that. It's very, very essential. You have to write that. Yes. So this 2016, he suffered osteoarthritis and it required total hip replacement surgery, which was not done immediately. But after 2 years, now it is September 2018, he underwent left total hip replacement. Okay. Okay, total hip replacement. Okay. Next one. And Cole's fracture. 1985, Cole's fracture. So now not there. ORIF. Okay, these not continuing now. So forget them. Those are not important because ongoing is important. 2016 osteoarthritis, for which he is taking now in 2018, he underwent surgery, replacement. So that is important. 1989 hypertension and ongoing management. Yeah, that is important. But 1985 Cole's fracture and ORIF, we don't need to think about that much. So forget that. Next one, medications. Okay, post-operatively. So post-operatively, this medication is important. So this medication is important. And this medication was taken even before aspirin 100 mg main. Okay, aspirin 100 mg main. So that was there before also. But during operation, it was suspended. And after operation recommenced, means started again. After operation, post-operatively, okay, it was recommenced, started again, stopped before he was taking this medication, aspirin 100 mg. Aspirin 100 mg before also he was taking. But what happened while undergoing operation? So it was suspended. But now after operation, it was recommenced, means started again. So that's it. So Ramipril 5 mg main. So you should know what is this main. Okay. Main and Nocti. Main means what? Nocti means what? So you should know the meanings of these words. If you don't know, you have to learn. If you don't know, you are supposed to learn. Okay. So that's important. Whichever is important, you must not miss. You must not miss. Right. Then next. Panadine Forte. This is pain relief. Panadine Forte is the brand name and paracetamol is the generic name. So when brand name is there, use brand name and avoid generic name. General or ordinary name is not important. Special name is important. Okay, 515 mg, codeine 30 mg. Okay, for pain relief, 2 quid, PRN. So you should know what is this. How are you going to translate this one? Is very important. 2QID, PRN. So what do you mean by this? That is very, very essential. That's very, very essential. You have to change it. Okay. And main or NOCTI or PRN. Okay. QID. You have to know what they stand for. Then next one. Nursing management. These are medications. These are medications. And this is nursing management and progress. So nursing management and progress. So you should know what it is all about. So once you get this one clear, we'll move on to the next one. That is nursing management and progress. So daily dressings. Daily dressings. Daily dressings. Surgery incision site. So these should be done. Okay, daily. So these were provided. Nursing management and progress means present. Next one, range of motion. Number 1, stretching. Number 2, okay, and strengthening exercises. So exercises, 3 types of exercises. One is range of motion exercises, stretching exercises, and strengthening exercises. All together, these are joined into one clause. Range of motion, stretching, and strengthening exercises. These are important. These were provided during hospitalization. Then, okay. Right. Next one. Occupational therapy is recommended. Occupational therapy is recommended. And staples to be removed in 2 weeks' time. That is on 21st of September. Because today is what date? Today is 7th September. 2 weeks. 7 plus 14 is 21 September. So from today onwards, on the 14th day, staples to be removed in 2 weeks' time. That is 11th of September. Fine. Then next one, additionally, also means additionally. Follow up. Follow up. So this should be followed up. Followed up means you are responsible for this follow up. So what follow up? So the tests should be followed up. Water tests, UEC test, okay, and FBE tests, full blood examination, and UEC tests, urine and creatinine. Okay, so these are important here. Where at the city hospital clinic, So they should come here. Okay. He should come here and he has to follow up at City Hospital Clinic. So this is very important. So these are the things done here and these should be done after discharge. Okay, right. Next one. Okay. Next. Next one is assessment. So post-operatively, okay, post-operation, good mobility. So good mobility post-operatively. Okay, good mobility. Earlier this was not there. So now this is regarding assessment. Yes, this is regarding assessment. So, weight bearing, the use of wheelie walker. Weight bearing, so he is able to bear weight. Okay, he is able to bear weight. Weight bearing with the use of wheelie walker. So this is very important. He is able to bear the weight. Then next one, walks the length of the ward without difficulty. Mobilization is possible to, okay, mobilization is possible, okay, for shorter distances. Length of the ward is a shorter distance. Ward from this corner to that corner of the ward. And post-operative disorientation was noticed regarding time and place during the recovery period. Okay, this is possibly because of that medication. Possibly this is related to what? Related to anesthetic. Okay. Possibly related to anesthetics. Medication, we can say. Post-operative disorientation regarding time and place during recovery. Okay, this is maybe related to anesthesia or anesthetic. So recommended continued observation because, yeah, dropped hemoglobins. Okay, post-operatively. So that is why recommended observation, continuous observation. Post-operatively, hemoglobin level dropped to 72. Okay, grams per, yeah, this is it. So you can check it out here. And requiring, so because of that transfusion, 3 units of packed blood cells. So this is required because of that. So post-operatively, so hemoglobin levels dropped to 72 grams per deciliter. So because of that, 3 units of packed blood cells were transfused. Now hemoglobin is stable at 120 grams per deciliter on discharge. On discharge. And ongoing means continuation. Ongoing monitoring required for anemia. So monitoring is important here. Right. Now discharge plan. discharge plan, medication monitor, medication compliance is required. So medication compliance is required. Monitor medications. Monitor medications. What are the different types of medications? So Panadine Forte, capital letter. Panadine Forte. Yeah. Then next one, preserve skin integrity. By what? By regular dressing. This is related to this. Daily dressings. That is skin integrity. Continue exercise program. That is related to again this one. Range of motion, stretching and strengthening exercise. You have to relate. Equipment required. Wheelie walker, wedge pillow, and toilet razor. So hospital is providing walker. So hospital is providing walker and pillow. Hospital is providing walker and pillow, and a hospital social worker organized 2-week hire of razor, toilet razor from the local supplier, local medical supplier. Yeah, from local medical supplier. So these are the things. Now these are what are important things you have noticed. Relevant and irrelevant information. Using the information in the case notes. Don't write your own information there. You can use the synonyms and other things, but don't write your in which is not related, don't write. Write a letter to Miss Samantha Bruin. This is the address of the recipient, Miss Samantha Bruin. And Miss Samantha Bruin is a senior nurse. Senior nurse. So Miss Samantha Bruin, senior nurse. And the name of the, okay, it is Grey Walls Nursing Home. Because he came from there, he is going there only. They know everything. So previous information you need not write. All the information which they know already you need not write. Then 27 Station Road, because he is going to the same place. He is a known patient. So 27 Station Road, then Grey Walls. So Grey Walls. So these are the 5 lines address. Who will be responsible for bakers? Why are you writing the purpose? Continuing care. Don't write continued care, write continuing care. So this is what is required. He requires continuing care at the nursing home, at their facility. So at their facility, following his discharge back to the facility, back to the nursing home. Okay, so this is what it is. Now let us see the important points here. All right. So the address is here. You can take the address from here 1, 2, 3, and 4 and 5. Right. So let us see here. Miss Samantha Bruin. Miss Samantha Bruin. Yeah. Yes, here it is. This is number 1, address. This is point number 1. Yeah. Yes. This is the address to which you are writing. Fine. So here this is 1.1. This is, you can say, 1.0. 1.0. Now we are taking here the address. The address. The address. So you can take this as the address. Fine. Next, this is 1.1. So 1.1. Next 1.2. Next 1.3. Next 1.4. Next 1.5. 5-line address. So 5-line address. So you can know, you can understand now what are the 5 lines here. So first one is the name. Second one is the designation. Third one is the nursing home. Fourth one is the street or road. Fifth one is the name of the city. Or however you want to write, you can write like that. So this is very important. This is 1 point. First you have to do like this. Yes. Fine. So this is finished. Then you have the date. Date you know is here in the beginning. Today's date. This is 2 point. This is today's date. 2.0. 2.0, the date. Today's date. Yeah. The date. You'll get the date from here. And third one is, okay, the salutation. Salutation. Salutation, again you go to the writing task. Here, this is the writing task. Then number, this is 3.0. 3.0. 3.0 is the salutation. Oh. The salutation. Salutation will be like, how it will be. This is the salutation. Miss Bruin. So you'll write like this. Dear Miss Bruin. Dear Miss Bruin. This is how you will write. So Miss from this 1.1 and Bruin, second name. Don't write the first name. Dear Miss Bruin. You're writing this letter to them. So dear Miss Bruin. So this is 3.0. This is very important. 3.0. Okay. Dear Miss Bruin. Okay, fine. Next, after this one, you will write 4.0, that is subject line or the reference line. So 4.0, okay, the subject line. The subject line you will write. What you will write in the subject line? Regarding, R capital letter, E small letter, regarding Mr. Okay, regarding Mr. Gerald, Gerald, Gerald Baker, aged, what is his age? You see here, 79, Gerald Baker, age 79, write down. Okay, aged 79, just write like that. Regarding Mr. Gerald Baker, age 79. Okay. Regarding Mr. Gerald Baker, age 79. This is 4.0. So this is how you are going to write. So then next one. So sixth one is done. And seventh one is also done. Sixth one is remaining. So here you are writing salutation, dear Miss Bruin. So name is given. So name is given. So what you have to write is, so yours sincerely. If name is given, in salutation name is given, write sincerely. If name is not given, dear nurse, dear manager, dear officer, or something else is given, then you have to say yours faithfully. Yours faithfully. Now, because this is dear Miss Bruin. Okay, so this 5.0, that is body. So 6.0. Now you have to go up. Here it is there, 7.0. Before this one, you will get 6.0. Yes, 6.0. This is the closing remarks. The closing remarks. Or you can say the signing off. Okay, the closing remarks are the signing off. That is based on, okay, so 4.0, that is, 3.0, salutation. So if their name is there, Miss Samantha Bruin, Miss Bruin. So name of the person is there, proper noun. So Simon Peter, Abraham Lincoln, Margaret Thatcher. So name of the person is given. Then you have to write yours sincerely. Yours sincerely. You are supposed to write yours sincerely. Name is given. Then you have to write yours sincerely. If name is not given, you have to write yours faithfully. So, be careful. This is a little dangerous. So I'm putting a red mark. So yours sincerely or yours faithfully. If you know the name of the person, Samantha Bruin, then you write yours sincerely. Then if it is written charge nurse or ward nurse or home nurse or doctor or manager or some other name of the profession is given, then you write yours faithfully. So that is how you are going to follow it up. So this is very, very important. Now coming to the point, Okay. So this is the point. Now what else is required here? Yes, let us see here. Fine. Now, Simon Peters. Yeah. Is now paragraphs. Now here, I'm going to show you all relevant information we have taken, which is unnecessary, not taken. So now, medical background osteoarthritis. Here you can take body paragraph 1. This is body paragraph 1. Medical background and medication. Body paragraph 1. You write body paragraph 1. This one. Then this one also. Medications to that one. Also body paragraph 1. Body paragraph 1. Then next one. So assessment. Assessment. Okay. You see here. Assessment. Assessment, you write body paragraph 2. BP2. Assessment, you write body paragraph 2. Then discharge plan, you write body paragraph 3. So simple as that. So first one is the main problem. Okay. So first one is why he was admitted and all these things, background. Okay. Admission and other things and medication. Admission and medication in the body paragraph 1. Okay. Body paragraph 1. Then assessment. Post-operatively assessment. That is body paragraph 2. Body paragraph 2. And this is body paragraph 3. Post-operative discharge plan. This is joining with this one also. Regular daily dressing. This will go there only. Okay. This will go into BP3. Okay. BP3. And these will go into BP2. Okay. Post-operative. Okay. Nursing management. This will go into BP2. So this nursing management will go into BP2. And this is post-operatively after discharge. So staples removal and follow-up blood, these things will go into BP3. So I'm giving a separator here. Otherwise you'll get confused. Yeah. So this is how it is. I hope you understand everything. So unnecessary things remove and write only these things which are important. Okay. Now let us see fast. I'll give you the mic. And what you can do is you can unmute when I call your name and you can speak what you understood. Chitra.
Good evening, good evening, sir.
Good evening, Chitra. Is that clear to you? Any doubts?
Yes, sir, I am clear.
Okay, Diana Shiba. Diana Shiba. Jacinta.
Yes, sir. Good evening, sir.
Good evening, Jacinta. Is that clear?
Yes, sir.
Any doubts?
No, sir. Yes, sir.
Nautej Kaur.
Yes, sir. Good evening, sir.
Good evening. Is that clear?
Yes, sir. Clear.
Any doubts?
No, sir.
Okay, Prashanti.
Yes, sir. Clear, sir.
Everything clear. Okay, fine. Any doubts you have?
Sir, near the date 7 September, we need to write September or the month number. Anything we can
See
write.
how it is given. Okay, if you write month 7 by 7, okay, we can understand. But if it is 7 by 8 by 2018, that means 7 is month or 8 is month, we don't understand. Because in some countries, 8 they will put first. Okay, month they will put first. Do you know that?
Okay, sir.
So in order to avoid that confusion, the standard rule is you have to write like this only. Month in full words. Okay.
Okay, sir. In full words. Okay, sir.
Yes. Otherwise, we do not know which is month, which is date. Okay.
Okay, sir.
Okay. Yeah.
Okay, sir. Thank you.
So that is your doubt got clarified. Yeah,
Yes.
Reshma, Raju, is that clear?
Hi, sir. Good evening, sir. It's clear.
Okay. Any doubts?
No, sir. It's very clear, understandable.
Okay. Shakila Rani,
Yes, sir.
is that clear? Shakila Rani?
Yes, sir. Yes, sir. It's very clear.
Okay. You will go to into the exhibition and you will leave the hand of your father and you'll go and buy whatever you want, right? Correct or not? I
Maybe,
missed you for the last 5 or 6 days. I don't know where you went.
sir. My son was sick. He got admitted in hospital, sir.
Oh, sorry for that. Sorry for that. But please keep me updated, okay?
Yeah, sure, sir. That
Because
is my.
you are very precious for me, okay?
Yeah, sure, sir. I'm sorry. I didn't inform you.
No
because-
problem, no problem. I'll be waiting, okay? Teresa, is that clear?
Yes, sir. It is clear.
Okay, always you should come with the same name like this, 2 names, okay?
Okay, sir.
Any doubts, Teresa?
No, sir. It is clear.
Okay, Sri Lata.
Sir, good evening, sir.
Good evening, Sri Lata. Sir, I don't know how to do writing, sir. I am confused. I am very much worried, sir. I don't know. Please explain me. Is that clear, Sri Lata, now?
It's very much clear, sir. The structure of the letter is very much clear. And coming about the body of the letter.
Yeah, that we'll see in another session, no?
Oh,
I
okay.
have already explained you how to divide, no?
Ah,
Now
right.
you
This
write it
is
next
very
time
much
I'll show
fine.
you. Okay. Now
This is
already I made the structure, which paragraph, what I have explained everything.
Yeah,
So
yeah.
you
That
try
is
to
clear.
write. Next lecture, I will explain that one.
Sure, sir. Sure.
Okay. And in
Yeah,
your
thanks.
correction, I'll do corrections, no?
Yes, sir. Thank you.
Okay, fine. Now what I want you to do is, I am giving you 2 minutes. And in these 2 minutes, you can write 1 or 2 sentences what you gained benefit from this particular session. So all of you can provide your feedback regarding this particular session. Okay, you have 2 minutes now. So what I'll do is I'll take this case notes and then I'm going to give this case notes to you. Okay, so this one I'll give you so that you can use it. So these parts, right? Edit, take a snapshot. Okay, sorry. Select all, copy selected graphic, and I'll put it in the Telegram channel. So here in the Telegram channel, I'm going to place it. Number 1. Okay. Next one is, so next page is here. Copy, select all, copy selected graphic, and here it is. So both the pages, I think I'll remove this one from here. Okay, this is first one I'll post. Then I'll post another one here. So page number 1 and page number 2 I have posted here. Okay, and I'll also post in the WhatsApp groups. Here it is. So copy image. So this is number 1. Next one, copy image. This is number 2. So I have already given you information. It is very clear now for you. So you can take this one, whatever it is. And what I'll do is I'll send this thing for you. You can use it. You can write your 2 or 3 sentences Okay. Right. And I am closing it within 1 minute. Tomorrow we'll take another letter. Every day I'll explain one letter. And today, before going to bed, you complete this letter and submit to me. Okay, all of you. Right. All of you, you have to submit these letters. Yes. So now I'll be waiting for your letters. So I will be waiting for your letters. I'll be waiting for your letters. So are you sending me the letter? Okay, today. Are you sending me the letter today? Yes or no? I'll be giving you 40 minutes now. After 40 minutes, I need your letter. If you don't correct your letter and if you don't send me your letter today, all these students who came today will not attend my session tomorrow. That's the final thing. No excuse. No questions asked, no answers provided. I want your yes, that's all. If you do not say yes, that means you're not sending the letter, and tomorrow you are not attending the session, because I lock the room. Nobody can enter without my permission. Just like an outsider, you go to the YouTube and search from there. I'm sorry. Every day I'll be giving you one letter. One day you miss the letter and next day you will not attend. I want it within 1 hour. 40 minutes time. Okay, no problem. 1 hour by the time you send. Get ready and send 1 hour exactly. So now it is 22:40. So 23:40. So before 12 midnight, I want your letter. So fine. Okay, then take care. Bye-bye. God bless you.